first start doing this type of thing?
Okay, now this started right at the beginning when I first discovered holographic breathing. And first, one woman had broken her leg, and she went to hospital. And I was speaking on the phone with her. She rang me up afterwards to say, she was in terrible pain, and the painkillers didn't work or anything. She said the only thing that worked to clear the pain was holographic breathing. So I thought, wow, brilliant. So it's great for pain relief. And then there were just mothers learning holographic breathing who were coming up to giving birth. And can I use this in giving birth? And I said, well, for sure. At that stage it hadn't been tried, and I kind of taught them how to work with the pelvis up to birth and how to be with the baby with holographic breathing up to birth. And so that the pelvis and the pelvic diaphragm and the uterus and the vagina and the cervix were breathing and soft. And it's not to just everything opens, it's you breathe the baby out, you breathe with the baby, you breathe with the contractions, you breathe with the whole process. So rather than it being an opening and an opening and stretching and opening and stretching and opening, it's open a bit, close, open a bit, close, open a bit, close. And that's far less stressful. There's not the end goal so much in that. It is a process of being with the process. A lot of pain is the denial of the sensations and the experience you are having at the time. And once you can be with the experience fully, it's no longer pain, it is an experience. And the same nerves in that whole area that women feel the pain with are the same nerves that give a woman orgasm. So it can switch across from pain to an orgasmic experience. It doesn't mean that the orgasmic experience won't have some pain in it, but that adds to the quality of it. So it's much better going into birth than kind of feeling it's open, just opening, and it's really painful, to its opening, closing. It feels a bit painful, but there's this orgasmic sensation going on at the time.
Which will put you in the present, won't it?
Put you in the present, and orgasm releases the endorphins. So that whole experience of being in the present, being in an orgasmic state, releases more the endorphins. I think I'm not sure exactly of it, but it's something like 20 times more powerful than heroin. So and the thing is, as soon as you start, or as soon as a mother starts using gas and air or painkillers, then their own natural endorphins, which were designed exactly for that process, start cutting out. And they're not just numbed to the pain, they're numbed to the experience they're having. So they're no longer embodying and able to enjoy and be with that experience. Mothers should really have a kind of in the tribes and things, there was a wise woman. The women could talk and be with each other far better than a doctor. My experience of it, to give them the information of how to be with this in that way. I've lost track a little bit there, but it's it's just that, being able to be empowered in the experience, in control yourself, rather than we are so used to handing our health over to a doctor, rather than dealing it with ourselves. We're so quick to pick up a pill or a shortcut, which never really seem to work. You deal with the initial thing of what's happening and nature.
Masking it, but yeah.
And yeah, it is trust. And the main things that cut down the endorphins are fear. And it's really easy. You start looking at the medical side and you start becoming fearful, or a doctor says, oh, not in a bad way. Oh, you better take some painkillers now. Oh yes, better do that. And it brings the quality of fear in. It really, the best things you can bring to a mother in birth are that she's comfortable in herself, she feels supported, she feels empowered, she is in charge of the situation. And when mothers are giving birth, they go into a place, they're not in the normal part of in the cerebrum, they're not in the intellectual part of the cerebrum, they drop back below the cerebrum into the cerebellum, which is a shamanistic place. Women giving birth go into a shamanistic place where being asked questions and having to use dialogue pulls them out of that place. And quite often this bit of making birth a social thing, and it's good that the father's there, it's good that the relative's there. I don't necessarily agree with that, because all the people around aren't in that space that the mother's in.
No,
it's
they're
good.
not doing it.
They're not doing it. A shaman or a healer would be able to allow the mother to go into that place of kind of transcendence and being with the earth and being in the shamanistic place for herself. And it's right in the back of the brain. So I don't particularly agree with lots of people around. And when I lived on a boat, the moorings I got was because the farmer wanted me to look after the cows in the field. And when a cow's giving birth, you see its tail goes up in the air, it's mooing and this and that, and it takes itself off by itself into a corner of the field. And all the other cows will go almost as far away as they can get from that. And she gives birth in that little corner of the field by herself. And then that the calf has come out. I don't know how the other cows know. As soon as the calf is out, all those other cows charge across the field and are licking this newborn calf and welcoming it in. So for me, birth is a shamanistic place. It's a place, it's a spiritual place. And the best thing you can give them is that they're allowed to go into that place and be with it. And you certainly don't want to be asking them questions or this or that, because it pulls them away. It's just, and I know medical things go wrong with it, and then great, have an ambulance to the hospital and you have stuff if necessary. But just having it instantly at hand, I don't think is always such a good thing. Actually doing it in a hospital. Oh yeah, now I need gas in there. Oh, I think I need an operation actually. Or whatever's there. You know what I mean? It's like sweet jars not to have to do it in a way. And absolutely, sometimes it is absolutely necessary. Things can go wrong, and then it's necessary to save lives. But and what I say to women with the holographic breathing is just try it. Try holographic breathing for yourself. And because this is how the breathing we use in holographic breathing is the same way, even though there's not air in the uterus where the baby is formed, the baby is doing a form of breathing. And the same state and the same thing of holographic breathing is a very similar place of the breathing we do in holographic breathing. And one of the main things mothers say when I'm teaching them this and they're pregnant, they say, oh, the baby started moving. So normally in the first 2 or 3 minutes, the baby starts bouncing up and down. And then the baby slowly drops and they say, oh, it's getting quieter and quieter until they feel it just sitting down deeper and just relaxing, and the babies just go to sleep in the womb. I think it really connects with the baby, and the way the baby is moving in birth and the contractions align exactly with holographic breathing. And then when the baby comes out, the movement of the jaw in holographic breathing is, or the movement of the mouth in holographic breathing is like a very subtle form of suckling. So in a way, the baby comes out and starts doing holographic breathing on the breast. So it's completely interrelated, and these movements, these cupping, opening and cupping of the hands and feet, we also use those in holographic breathing, those same initial movements of the baby, the movement of the mouth, the movements of the hands and feet. These are exactly the instigators in holographic breathing. So it is all part of that arena. And I say to the mothers, try it, learn it, and try it in your birth, but don't go in, oh, I've got to do holographic breathing.
Right.
You may not want to. It may not be right for the situation that, I've had one mother, she did the holographic breathing, and she loved it, and she was using it for her own process, and she went into the birth, and it was great. It made it much slower, much more meditative. There was absolutely no pain. But in the end, she wanted a much kind of more active one, and about halfway through, she just moved to a much more vigorous breath because she felt she wanted that. So it's whatever you feel at the time. I'm not saying giving a rule book that you've got to do this in this way. And you can use other types of breath for breathing as well. Francois Friedman said that holographic breathing was the only breath at the time. I haven't seen her for a long time, but at that time when I was teaching her and it was going out in Birthlight, she said it was actually the only breath she would recommend for mothers. She didn't recommend any of the other breathing systems. So, it works well. And it's not only just for pregnant women. People can come along because inside us is our own birth that affects us and our own internal experience of womb life. Anybody who wants to come along and experience that for themselves can as well. My expectation is, for the classes guided towards birth. And it is also for mothers after birth, because the movement of holographic breathing is very similar to suckling. So when women have trouble breastfeeding their babies, it's great just to do holographic breathing. And the baby kind of relaxes down, and so the mother and the baby are kind of doing the same thing. And healing, we do healing with holographic breathing. So if the baby's upset, she can just put her hands on the baby and gently do holographic breathing. Certainly if the baby was used to holographic breathing when it was in the womb, then this normally really relaxes and calms the baby down. But to the main part, that the babies that have been given birth with holographic breathing, just very quiet, and they don't cry much, kind of happy babies. And I haven't taught it to a huge amount of women, but every woman I have taught it to has had an absolutely natural birth without any needs for anything.
Brilliant.